Welcome to the Scientific Sense podcast, where we explore emerging ideas from science, policy, economics, and technology. My name is Gill, Eapen. We talk with world's leading academics and experts about their recent research or general areas of topical interest. Scientific Sense is an unstructured conversation with no agenda or preparation. We cover a wide variety of domains where new discoveries are made and new technologies are developed on a daily basis. We are most interested in how new ideas affect society and help educate the world how to pursue a rewarding and enjoyable life rooted in science, logic, and information. We seek knowledge without boundaries or constraints and provide unedited content of conversations with researchers and leaders who love what they do. A companion blog to this podcast can be found at scientificsense.com, and this podcast is available on over a dozen platforms and directly at scientificsense.net. If you have suggestions for topics, guests, and other ideas, please send them to info@scientificsense.com, and I can be reached at gill@eapen.info. My guests today are Professor Sarah Komisarow, who is Assistant Professor of Public Policy at Duke University, and Professor Emily Pakhtigian, who is Assistant Professor of Public Policy at Penn State University. Welcome, Sarah and Emily.
Hi, thank you so much for having us.
Thanks for having us.
So I want to start with, you had a couple of very recent papers, and one of them just came out this year. Are power plant closures a breath of fresh air, local air quality, and school absences? You say we studied the effects of three large, nearly simultaneous coal-fired power plant closures on school absences in Chicago. We find that the closures resulted in a 7% reduction in absenteeism in nearby schools relative to those further away from the closures. So before we get to the details of this, I just want to mention, Sarah and Emily, I spent quite a bit of time in the Chicago area, both on the north side and south side. I have no conflict of interest. I used to be in the power plant sector, but mostly in the nuclear power plant. So I haven't done anything in the coal-fired power plant arena. So before we get into the details of the paper, so coal-fired power plant, these are thermal plants that is creating electricity, right?
Yes, that's correct.
And so it's sort of curious that you had three power plants close, you say nearly simultaneously in the Chicago area. So what was the cause of that?
Yeah, so the three plants that closed in Chicago, this was in 2012. Two of them were actually owned by the same company. They were pretty close together. The third was actually just outside of Chicago in Hammond, Indiana, which, for those familiar with the geography, is just over the city border and the state border. And these three plants were sort of the subject for many years of litigation, sort of changing environmental regulation, and in advance of some previously announced timelines that the sort of parent companies that own these plants had said, like, look, we're going to close these down in the coming years or retire them. Our understanding is that the parent company sort of accelerated this process due to just the increasing costs of keeping these plants operating, particularly during a time period when natural gas was becoming cheaper, and so the companies just sort of changed their plans somewhat abruptly and closed them in 2012.
So they were all owned by the same company?
They were owned by two companies. One of the companies owned two plants and another was owned by a second company. Yeah.
And so they are quite close to Chicago, and that makes it sort of convenient for your study. Chicago has a lot of school kids. So do you want to talk a bit about sort of the scope and the size of the study?
Sure, I'll I'll keep going here. So yes, two of the plants were actually located in Chicago's city limits. They're located on I believe it's the South Branch of the Chicago River, and so it is unusual, at least to our knowledge in the U.S., for plants to be located inside of major cities. It's much more common for them to be located sort of more remotely or outside of cities, but Chicago was sort of unique in this respect. And then you have the third plant, the State Line Generating Station, that was, as I mentioned earlier, in Hammond, Indiana, just outside of the city. And the sort of spatial concentration of these three plants was indeed very important for our study, along with the fact that they happened to close right around the same time. In the paper, we say nearly simultaneously because it was within a 6-month period, March to August of 2012. And so that was really important for our study, in that it provided this context where we could look at the effects of these closures on, in one of our papers, we look at school absences. That's the paper you mentioned. In another, we look at emergency room visits for asthma-related conditions among young children. But you're absolutely right that the sort of unique circumstances of these three plants being so close to each other and being inside of or very close to a major city was one of the reasons, actually, that we, I guess, set out to write this paper. We don't, or at least I'll speak for myself. I don't know of other circumstances in the U.S. where there has been sort of a context like the one that we studied.
So Emily, so how many? So what's sort of the size of the study? So how many kids? How many schools did you look at?
Yeah, absolutely. So this picks up on Sarah's point that examining this within the context of, a large city, the city of Chicago, was important to the design of our study because it gave us a large enough sample of elementary schools to examine the impacts of these closures. So we constrained our sample to elementary schools within the kind of Chicago and Chicago adjacent areas. So we mostly looked at Chicago public schools districts, but we have a couple of districts to the west of Chicago as well that fit into our sample. For an overall sample of approximately, I think it's right around 450 elementary schools in our sample. And we have data from these schools starting in the 2008-2009 school year and going through the 2015-2016 school year. So we have, several years both before these closures took place and after these closures took place in which we follow these schools over time. So all of our analysis for our examination of school impacts are at the school level. So looking at this sample of approximately 450 elementary schools in and around the Chicago area. And that's our main sample size for that paper. I'll just note that in our the other paper that Sarah alluded to, in which we look at the impacts on emergency department visits for asthma. In that paper, we actually use zip codes in Chicago. And so that's a somewhat smaller sample size and a slightly different kind of empirical setup. But overall, that's the sample that we use in these studies.
Yeah, I mean, it's amazing data sample, 450 schools. It's a large data set. But longitudinally, what was the horizon what was the time frame that you're looking at?
Yeah, so we're looking at the period starting with the 2008-2009 school year and ending with the 2015-2016 school year. So that gives us, a couple of years before that 2012 year where these closures took place, and then a few years after to actually measure both the overall impact of these closures right around the time in which they closed, but also the dynamic effects of what these reductions in pollution from these coal-fired power plants meant, both right after the closures, but in the years following as well.
Yeah. I don't know a lot about this, Emily. I was just thinking that you're measuring absenteeism, and there is always a correlation causation issue. So, any other factors that might have affected this in any way?
Well, so what we do in our empirical setup is to try to disentangle kind of the impact on schools that we expect to be more impacted versus less impacted. And so what we do is we use a difference in difference specification to examine the impact of these closures on schools that are within a small radius, within a 10-kilometer radius of the closed plants. And we compare those to schools that are located outside of that 10-kilometer radius. And then we look at changes both, before and after the closures. And so that helps to address some of the concerns about, the causality versus correlation question. And it helps to rule out some of these, potential, other impacts or other changes that could have taken place during this time. And the reason that this helps to rule some of those pieces out is because there would have to be, other policies or other industrial changes or other pollution related changes that kind of affected schools in the same spatial and temporal manner that our coal-fired power plant closures did. And so by using that difference in difference specification, we can kind of try to avoid some of those additional challenges that we would see, without having this longitudinal data.
Yeah. And Sarah, so you're mentioning absenteeism here, and presumably absenteeism is related to pollution-driven issues. But do we have any sort of robust data that shows that?
Yeah, so we are one of the stories that we're trying to tell in this paper is that the absences that are school absences that are decreasing following the plant closures is actually coming through at least partially improvements in children's health. So in the our power plant closures, a breath of fresh air paper, the one that's actually about school absences, we provide some supporting evidence where we empirically investigate the effects of these plant closures on emergency room visits for asthma-related conditions among school-age children. We do a similar thing in our other paper where we're looking at emergency room visits for asthma-related conditions among young children. And in both cases, we find pretty substantial decreases in rates of emergency room visits. And so we're sort of empirically documenting that accompanying this decrease in absences are these two notable, for separate age groups, school-age children versus young children. But for both of these age groups, we see pretty substantial declines in these ED visits. And so that is our sort of empirical contribution to say that we think that underlying these reductions in school absences are improvements in children's health. It's possibly not the entire story, but we think that at least it's consistent with this idea that the plant closures are leading to sort of better health, particularly as it relates to asthma. And then the last thing I'll say is we're citing evidence that we're not necessarily the people who do this type of research, but literature from public health, from medicine, documenting sort of the correlation between air pollution exposure and, poor respiratory, in particular, health outcomes among children. And so we're drawing on sort of those literatures to say, hey, we think this story sort of makes sense that these reductions in school absences are possibly coming through improvements in children's health.
Yeah. Yeah, I mean, these two papers in together. So the other paper that you have, the effect of coal-fired power plant closures on emergency department visits, as you mentioned, for asthma-related conditions among 0 to 4-year-old children in Chicago, and it's the horizon of 2009-2017. These two papers in combination says a very interesting story, right? And so in this paper, you say exposure to ambient air pollution, especially among young children, is a serious public health concern. given their ongoing physical development, smaller sizes, higher breathing rates, and activity patterns, children face higher ambient air pollution exposure and are more susceptible to negative effects than adults. Now, this is a phenomenon. So you sort of, in some sense, I don't know if this is the right term, Sarah and Emily, lucked out because in the Chicago area you got 3 plants closed and you got a bunch of data. Do we know if there is any such data outside the U.S.?
So there certainly is both literature and data on these types of relationships between air pollution exposure and outcomes both for children, for adults, and for elderly adults, both inside and outside the United States. So I actually, one of the things that brought Sarah and I together for this collaboration was my work in the environmental space, specifically looking at the relationships between air pollution exposures driven by forest fire activity and health and other kind of economic outcomes in Indonesia. And so Sarah and I had been talking about some of my work looking at those relationships and that led to some of these collaborations in the United States. So abroad, and particularly in low and middle income countries, there's both energy related air pollution, just like the one that we study in our paper, right? There are coal-fired power plants and brick kilns and other kind of industrial related polluters that generate pollution and that the research looks into. But then there are other phenomenons such as kind of forest fires and particularly severe forest fire seasons, as well as indoor air pollution and cooking technology that have all been used as ways to kind of measure the relationship between air pollution exposures and health and other human capital or economic outcomes. Much of this literature looks at effects on very young children, on infants and children under the age of 5, which is what we do in our paper as well. But there's also evidence that other vulnerable populations, such as elderly adults, or people with compromised immune systems or other underlying health concerns, are also more impacted or more vulnerable to these exposures.
Yeah. Sarah, I mean, this is an important piece of information for policymakers, right? So in a 20 trillion economy, we spend $4 to $4.5 trillion in healthcare. And if you were to truly internalize societal cause, we can clearly see certain technologies, certain status quo technologies are not really viable. But do you think the policymakers have a good grasp of what's going on?
That's not exactly sure how to answer that. I mean, I think one of the things that we wanted to demonstrate, in a small way in this paper, is that there are costs associated in terms of human health, costs associated with the way that we generate energy. And, we're not the first people to say this, but, this is our sort of contribution to say that, like you mentioned, these types of activities are costly for human health. And I think we're beginning to have some sense, this is a very active and, growing area of research. We're starting to have a sense of exactly the magnitudes of those costs.
Yeah, I mean, I haven't seen anything like this, Sarah and Emily. The shift. So the sort of the comparison between fossil fuel powered energy production and non-fossil fuel powered energy production. We have sort of the basic heuristics there. We can measure those things. We can look at productivity, efficiency. But I haven't seen too many things that looks at the health cause of these things. And presumably the health costs are probably an order of magnitude higher than sort of the incremental things that we measure. Emily, do you agree with that, or what do you think?
Well, so one of the things that I think is kind of interesting and potentially unique about particularly our application for looking at school absences is that we are speaking to these kind of, this proxy for health, right? These school absences, these kind of asthma-related impacts. But we're also thinking about kind of some of these broader externality changes associated with the ways that we generate electricity. And so research like this paper, hopefully is informative for policymakers who really do want to think through all of the different costs and benefits associated with, our energy production and planned energy transitions. And so I think you're right that, there's work out there, both from researchers within the government, but also researchers in academic positions that is kind of trying to examine what some of these, health impacts of air pollution look like, because often when we're doing these kind of impact evaluations of big pieces of policy like the Clean Air Act or the Clean Water Act, but particularly in the air space, it is those health impacts that really generate kind of some of the biggest benefits. And so by thinking about this holistically, right, both the kind of health related impacts, the potential educational related impacts, which, other research shows has, potentially long run influences on potential earnings for these children. Those are the pieces that we need to start stringing together for policymakers to put together the full picture of the potential costs of different types of energy generation to make more informed policy decisions for, energy transitions, renewable energies, fossil fuels moving forward.
Yeah, exactly. I mean, the long-term effects could be quite high. It seems to me that it's multifactorial and exponential. So kid doesn't show up. You're looking at 0 to 4-year-old children here, unable to show up to school because of a health reason. It has so many implications for society. Lower education leads to crime. Lower education leads to, basically lack of productivity for a long horizon. So net present value decline due to this policy is quite substantial. So, I always felt that we don't really have a policy infrastructure that looks at sort of strategic costs of policy. I don't know, Sarah. Is that possible?
I mean, I think there are economists, other social scientists who are trying to sort of put these types of pieces together, and trying to understand how, early life influences that could be sort of even before you're born, but also experiences in early childhood, how all of those things are related to your long run outcomes. And I think other people have done sort of tremendous work trying to better understand these things. And I think of our work as sort of contributing to this overall conversation and saying, look, like we can document that, this policy in particular, having your school located near a coal-fired power plant, living near a coal-fired power plant, negatively impacts you when you're young, negatively impacts your health, negatively impacts your ability to attend school. And there are others then I think that are doing the work to connect those types of things to longer run outcomes, and to sort of the opportunities that people have throughout their lifetimes.
Yeah, so there's also sort of so what happened when these two companies shut down these plants? Presumably they had some sort of a plan to substitute for them, right? Did they?
Gosh, I can't exactly remember what has happened with the 3 sites. I think, I don't exactly remember.
Yeah.
I think, Emily, at least one of the plants has other activity at it. Is that right?
Yeah. So, some of these plants are still operating in very limited capacity through natural gas conversion. So there's some natural gas generation that's occurring at least one, if not two, of these sites, but it's to a kind of much lower extent than the coal-fired power operations. And then, of course, natural gas is a cleaner fossil fuel, although still a polluting fossil fuel. And so there was some natural gas transition. The parent companies that owned these plants, as Sarah alluded to at the beginning of this conversation, did have eventual retirement plans. And so there were, plans in place for energy generation to continue, right? It's not like these plants went offline and all of a sudden there were big outages of electricity that occurred in these areas. Rather, there was kind of a plan to transition to other sources and generation from other parts of the country. And the state of Illinois as well. So I think that partially goes into it as well. Although, just like these plants were retired before the kind of overall retirement plan had been put into effect, some of those transitions may have had to speed up a bit as well. So I think, that's kind of the general sense that we have from our understanding. But, you raise an important point that, it's not the case that when one plant goes offline or we think about these energy transitions, that we don't need to think about that secondary step of, what is the transition? How do we make sure that people still have access to the electricity that they need for their everyday lives?
Yeah. So is this a Chicago phenomenon, Emily, or other states are doing something similar? I know that we had a great president just a few months ago who was pushing clean coal. I don't know what that means, but is it a Chicago phenomenon or something that is every state is doing?
So the last decade has seen substantial declines in the use of coal for for electricity generation in the United States. So to just give you two examples of states that I know a little bit more about, one is Illinois, of course, where Chicago is located. Since 2008, there have been approximately 20 closures of coal-fired power plants. Three of them, or two of them, I guess, because one was in Indiana, are the plants that we look at in this study. But this is kind of part of this overall trend in the state, but also in the broader U.S. as well. So Pennsylvania, where I'm now located at Penn State, has also seen a large reduction in operational coal-fired power plants. Approximately 20 plants have closed in the last decade, and there are large, energy transition plans here in Pennsylvania, thinking about transitions, away from coal and in Pennsylvania, particularly to natural gas, and considering other renewable energy sources as well. So there have been large reductions in coal as an electricity source in the United States in the last decade. That being said, it is still an important electricity source. So, I think about 23 to 24% of U.S. electricity is generated via coal. Currently, that's down substantially from a decade ago, but still not an insignificant component. And coal is, the most damaging, most polluting fossil fuel out there. And so, thinking about some of these transitions is important for a clean energy transition, right? We see our current president kind of talking about, making sure that infrastructure plans and other policies are aligned with our climate objectives. And so thinking about these transitions to less polluting fuels or to renewables is really an important component of that.
Yeah, so I just want to ask you, Sarah. So I was looking at the chart that you have in one of the papers, Operation Coal-Fired Plants and Population of Children aged 0 to 4 years. And I see a big blob at the corner of Pennsylvania and New York, and I see a big blob in Chicago. Now, this is sort of counterintuitive to me from a sort of a binary political landscape that we have. It seems like New York, Pennsylvania, and Illinois, in Chicago more specifically, are more affected by this. So, how does one explain this from a political perspective?
Well, so one of the things I want to just mention about this figure is that I think you're talking about in the paper is that those blobs are big because they're population weighted, and so they're showing the locations, and so part of that is just showing that like these are places where lots and lots of people live. So even if there's one plant there. These are trying to show the number of 0 to 4-year-old children that live within 10 kilometers of, who live in a zip code whose
Yeah.
centroid is within 10 kilometers. And so, I mean, the pattern I see from this figure is that, there are sort of these regional patterns of where operational coal-fired power plants. This map might be slightly outdated because it is from 2016, and as Emily mentioned, you have sort of large numbers of retirements in the past 10 years, past 5 years, and so but you definitely do see this regional pattern where a lot, at least to me, of the coal-fired power plants locations are concentrated in sort of the Midwest and the East Coast compared to looking at, say, the western or southwestern parts of the United States where
Yeah.
these plants are just far, far less common. And so,
Yeah. The West is completely clean. California, Oregon, and Washington is a clean slate.
yeah, I think there might be a few plants located there, but yeah, far fewer. And as you can see, the scale of the sort of dots, if you will, on those located in those states are much smaller, indicating that those are located in parts of those states where there are not a lot of people nearby. And so you see sort of very, very different regional patterns in the locations, and then also sort of how close to populated areas these plants are.
And one
Yeah.
other thing that I just want to add to this discussion is that, coal-fired power plants have been around for a long time. These plants that are closing in Chicago, and these plants that, are closing in Pennsylvania, some of them have been in operation for a century, right? Or have been in operation since the late 1920s. And so there is a bit of infrastructural path dependence here that I think these figures kind of show, right? Places that were industrialized earlier, places that were big hubs and needed a lot of electricity access. Those are some of the areas where some of these kind of older pieces of infrastructure exist. And I think we see a little bit of that in the maps as well. Perhaps the next decade we'll see lots of changes there and new infrastructure investments. But these plants that closed down in Chicago had been operating for decades, and so it's not a new technology.
Yeah, that's a good point, Emily. I was wondering, politicians who really want coal and fossil fuels in general seem to be sort of in the southern part of the U.S., and at least on the surface, we don't have a lot of coal-fired plants in the South. We have them in more what one might call blue countries, Pennsylvania, New York, Illinois, and that is sort of counterintuitive in some ways from policy perspective.
Yeah, no, I think you're right. I think, Sarah's point that this is, that it's a little bit skewed by those population weights is a good one, right? That we're kind of seeing the population impact, but that doesn't detract from your point that there is this disconnect. And I think that's why we're starting to see, even at the state level, some of these state or regional initiatives to shift away from coal as well. So, for instance, the Regional Greenhouse Gas Initiative, or RGGI, is a kind of consortium of northern and northeastern states that has created a fairly well-functioning kind of cap and trade system for reducing pollution and pollution from coal and other fossil fuels in that area. And for instance, Pennsylvania is kind of currently in the process of potentially joining RGGI. And so you're seeing kind of some of these subnational, these regional arrangements, these state level policies that are seeking to address some of these issues. And so, I do think that there could be changes coming in the future to what these maps might look like of impacts, both from a population perspective, but also from a geographical perspective.
Yeah, I think that's right. So we have a legacy infrastructure to think about, sort of legacy policies, and the transition from legacy to the new is not easy. So I guess in some sense, the big cities in the Midwest and the Northeast are saddled by legacy policies that we have to transition out.
Yeah, and we see this, outside of energy infrastructure as well, right? I think we might see similar trends in transportation or in other types of infrastructure, and I think it's something that'll be really important for for policy moving forward, thinking about the appropriate ways to respond to some of these infrastructure needs.
Yeah. We'll take a quick break, Sarah and Emily. When we come back, we'll talk about some of your other papers.
Great. Thank you.
Thank you. This is a Scientific Sense podcast providing unscripted conversations with leading academics and researchers on a variety of topics. If you'd like to sponsor this podcast, please reach out to info@scientificsense.com. So we're back. Sarah and Emily, we were talking about coal-fired power plants closures in the Chicago area, and how coal-powered power plant closures actually affect the health of young children. We looked at absenteeism, we looked at emergency room visits, and so on. It's very clear that, and it has been clear for many, many decades now, that coal-powered power plants are pretty polluting to the environment. I want to go into some of your other papers. Emily, you had a paper in 2019 valuing the environmental costs of local development, evidence from households in Western Nepal, in which you say environmental quality is rarely prioritized along with the development pathways of developing countries, even though little is known about how individuals in the settings value intact environments. So you conducted a survey there, a pretty large survey, 3,600 households living throughout the Karnali and Mahakali river basins in Western Nepal. So what do you find in this survey?
Yeah, so this study was actually part of kind of this larger effort to characterize water use, water access, and kind of water quality in Western Nepal, in these two river basins. And one of the pieces of this project that we were really interested in was kind of the trade-offs in potential development pathways in the region, particularly thinking about developing water use infrastructure such as large hydroelectric dams or kind of large diversion projects for irrigation and agriculture. And these types of infrastructure projects kind of initiate trade-offs with environmental quality and intact local environments. And as you may know, Nepal is a country that actually has a lot of potential economic benefits associated with intact environments. There's a lot of trekking and rafting and other types of environmental tourism that could be a potential environmental or economic productivity pathway as well. And so what we were kind of interested in understanding in this study was how local populations valued kind of environmental conservation and intact environments, and whether or not they would kind of value that type of maintenance of environmental quality over other types of development infrastructure or other types of economic pathways. And so what we do in this study is we run a contingent valuation survey, which essentially asks households to state how much they value kind of local environmental conservation. And what we find in these areas is that there is a positive valuation for local environmental quality, that households, are willing to contribute in the sense of this stated preference survey, contribute to land conservation and to maintain their local environments. And we see that there are certain household characteristics such as education that kind of correspond with higher levels of conservation attitudes, which suggests that there might be some variation in these values. And so this is kind of the overall goal of this study was to really try to understand some of these preferences and demands for local environmental quality within this broader context that there are these trade-offs for thinking about development within the region across sectors and across different development trajectories. And that's really what we are seeking to understand.
Yeah, this is really interesting, Emily. So sort of the localization of the good, right? Localization of the environmental quality, then the locals can put a price on it because they can directly attribute environmental quality to economics, tourists, and other aspects. So do you see some sort of an application of this idea more generally? Yeah, I think the problem we have in the world today is that people can't really attribute their actions directly to some economics. It seems too far-fetched, it seems too nebulous, too uncertain that they don't want to take that action. Do you see some applications?
Yeah, so this is certainly a challenge, and this is something that the methods that we use in this paper, these kind of stated preference type valuation, non-market valuation methods, really do try to speak to. And so for instance, we tried to make the context that we were asking these households to value very clear to them and very localized, right? We wanted to understand what these households thought about natural land preservation in and around their communities. We wanted to make this something that they could directly relate to, and that they could think through how they might use locally preserved land or what value they might really place on that. And so in this context, drawing that local connection was really important. That being said, more broadly, these types of methods, such as contingent valuation or other stated preference methods, have been used to try to value other types of non-market goods within the broader kind of environmental policy space. And so perhaps the most famous example is the use of contingent valuation to try to understand how or kind of try to value the damages of the Exxon Valdez oil spill that took place several decades ago. And this was one of the first kind of policy-related applications of contingent valuation, in which the researchers there and in fact the policymakers there were trying to understand how populations valued the kind of loss of environmental quality associated with a large oil spill. So we have seen these types of methods being used in the policy space. The important thing is kind of getting the methods, as accurate as possible, because of course we are asking people to value things that don't exist in a market setting, and that can be quite challenging. So making sure that you're spending the time with respondents and making those contexts specific and applicable enough really does help to make sure that respondents are actually responding to the question you're trying to ask, and you're getting a true valuation out of that type of method.
Yeah, so I find it interesting, Emily, that you say that we find that households with higher levels of education exhibit higher willingness to pay. That is very intuitive.
Mm-hmm.
But you say, as to male respondents, that is very counterintuitive to me. So why do you think that's the case? Typically, men are not very good in doing these types of things.
So one of the things that is important to think about, in this particular context is the role of different household members in managing household finance. And so in many of our households that were part of this study, the gender norms, the social norms would dictate that women are far less likely to kind of be in control or have a lot of autonomy over household financial decisions. They might be involved in decision-making processes. We do find some evidence of that in our survey as well, but they're less likely to be the sole decision maker. Whereas many of our male respondents are coming from households where men are directly related in these financial decisions for the household. And so some of this is reflective of the actual context in which we're doing this contingent valuation study. And that's actually encouraging. One of the concerns about stated preference type methods is that you're simply asking people for their valuations, and it can be hard to make sure that you're getting those valuations, as unbiased as possible. And so in a context where we might expect men to have more autonomy or more comfort in kind of dictating where the family resources might go, it's encouraging to see that our results are kind of reflective of that social context. And it's also informative for thinking about, how to make sure that both men and women do have some of this autonomy and do have the opportunity to actually share their true preferences, right? So one thing that we might be concerned about is that if women, have more limited financial autonomy in this setting, that their valuations, are somewhat of an undervaluation for environmental quality in this context, which suggests that our overall results would be kind of a conservative, lower bound in this case. So pulling in kind of the local context, the social context, is really important for interpreting and understanding these results.
Yeah, exactly. Yeah, that's a good point. Sarah, I want to go into one of your papers.
Sure.
Can community crime monitoring reduce student absenteeism? In this paper, you say we studied the impact on student absenteeism of a large school-based community crime monitoring program that employed local community members to monitor and report crime on designated city blocks during students' travel and from school. I don't know the location of this area. Is this in Hyde Park?
This is all over the city of Chicago. So
Okay.
It's a Chicago Public Schools initiative called the Safe Passage Program.
Okay. So what do you find there?
Yeah, so in this paper, my co-author Robert Gonzalez and I look at the effects of this program on students' absences. So in some ways, school absences are an interest of mine as someone who studies education policy. And so we were interested in whether having these civilian community monitors, so I just want to emphasize these are not police officers, these are civilian members of the community who have sort of basic training, but that work as monitors or sort of a designated adult presence, set of eyes while students are walking, traveling to and from school. And so we wanted to know if this had effects on how frequently students attended school. So this is, I should say, companion work to some other work we've done that's published looking at the effects of this exact same program on crime rates in the vicinity of public schools. And so what we found, I think somewhat surprisingly to us, maybe this was not exactly what we expected when we started the project, was that this civilian presence during students' travel to and from school has pretty substantial effects on crime rates in the vicinity of these schools. So in the local areas where these monitors are working. So we, in the paper, I think, do a careful job trying to, appropriately try to understand and design a research study that gives us some sense of, how crime rates are declining in other unmonitored parts of the city, but sort of abstracting from that, we do find that this community crime monitoring program has pretty substantial effects on crime. And so this absences paper, just to return to your initial question, was trying to understand if that sort of improved environment in the vicinity of schools led students to miss school less frequently. So we're not able in the paper to exactly identify the mechanisms responsible, but we do find that absences decrease in schools when these monitors are present. And so we think that has to do with sort of being in an environment where there's sort of less stress, less exposure potentially to crime in the neighborhood, and that could be children being stressed about sort of the local environment, or also parents being worried about sending their kids to and from school. And so we don't exactly know which of those factors is at play. We think it's likely both, but we find that this program has impacts on how frequently students attend school, and we find that they miss school less frequently when these monitors are in place.
I can understand this, Sarah. So when I was growing up in South India, it's sort of a community involvement that, you cannot engage in any misbehavior. I found that the news traveled faster than light. I think Einstein is still wrong. My mom knew, if I engaged in bad behavior, a lot faster than the speed of light. And so it's sort of the community civilian involvement, right? Yeah, in the process that makes a huge difference.
Yeah, we think that could definitely be part of it. Knowing that there are, community members around you supporting you as you're, going to and from school. We think that could potentially be at play as well. Yep.
Yeah. You have another paper, Comprehensive Support and Student Success. Can out of school time make a difference? Out of time school, what do you mean by that?
So, I mean, in this paper, I'm studying a program that is supporting students' academic, social, and personal development outside of the school day. So, providing academic and other types of enrichment activities both after school and during the summer. And in this particular paper, I was very fortunate to work with an organization in North Carolina that had used admissions lotteries, which is something that economists love because it's kind of close to a randomized experiment. But basically, this organization was in circumstances where they had more students who wanted to be part of this program than they had spaces available. And so they used sort of like a lottery or random assignment mechanism to say, these students will be given the available spaces. Unfortunately, these students will not. And so in this paper, I'm able to track the outcomes of students as they progress through middle school and early high school. Comparing those that participated in this after school and summer programming versus those that didn't, trying to contribute to this question of how sort of supports outside of the school day can help, in particular, students from low-income backgrounds and sort of other disadvantaged circumstances who are struggling in the public system as it is without these supports.
Yeah, so sort of similar theme, right? So some sort of outside support seems to have a lot of beneficial effect on outcomes.
Yeah, so this is a larger theme in my research and is reflected in some of the work that I'm doing currently. I'm interested in sort of how all of these factors, whether they be supportive programs in the community, whether they be, a community crime monitoring program, but also, the local environment, whether you happen to live near a coal-fired power plant, for example. I'm really interested in how all these out-of-school factors affect what's happening with students as they progress in school.
Yeah, I mean, it's fascinating because, it might be that the eventual outcome is more dependent on out of school factors than in school factors. Do you have a sense of that?
Yeah, I think that's a really hard question for me to sort of like put a number on or try to quantify, but in my work, I am trying to understand, or at least make the point, and I'm not the first person to make this point, that the out of school factors matter a lot. And so the things that are happening in students' lives outside of school have effects on their outcomes and their trajectories and sort of their the opportunities that they have as they progress through our system, our educational system.
Yeah, so Emily, I want to finish up with one of your recent papers. Does improved risk information increase the value of cholera prevention? An analysis of stated vaccine demand in slum areas of urban Bangladesh. So you're sort of measuring what an individual in Bangladesh is willing to pay to avoid cholera. Is that the way to think about it?
Yeah, so in this paper, really what my co-authors and I are trying to understand is kind of the relative valuations of treatment and prevention of cholera. And so yes, you're absolutely right that we're interested in understanding, what a household or what a willing to pay to reduce their likelihood of contracting cholera, and we do this by measuring willingness to pay for cholera vaccination. But we're also looking to compare this to what households are kind of actually paying when they do contract cholera. And so we have hospital administrative data on kind of cholera admittance and the cost of illness of these cholera admittance. And so we're able to kind of use this approach to look at both, willingness to pay, your stated willingness to pay for prevention versus your actual payments for treatment, to provide kind of a picture of what treatment and to provide a picture of the trade-offs between cholera prevention and cholera treatment within our sample area.
Is mortality rate sufficiently low that it wouldn't affect your observations?
So we are mostly, considering non-fatal cholera incidents. We certainly are considering that within the kind of treatment side of things, because we're looking at kind of, in terms of prevention side of things, because we're looking at possible willingness to pay for prevention for vaccination. On the administrative side, the hospital records, we don't see overly high rates of fatalities, at least with the administrative records that we have. That being said, cholera is an endemic disease in Bangladesh and can be fatal, particularly for young children who are particularly vulnerable to things like dehydration that result from prolonged diarrheal disease. And so it's certainly not the case that there aren't fatality concerns, but they don't play a huge role within our sample.
Yeah, so you say that we estimate that the household incurs costs approximately $10 per episode of cholera that requires medical treatment. But from a policy perspective, from the perspective of the government of Bangladesh, there is huge productivity losses, not only for the individual, but for the entire family. This appears to be, at least on the surface, a no-brainer from a policy perspective, right?
Yeah, so you're certainly right. We do try to measure some of the productivity costs associated with an episode of cholera, whether that is an adult who contracts cholera and therefore, does have to miss work, or if an adult needs to miss work due to the need to care for an ill child. So we do try to measure some of this within our cost of illness estimates. Although, I will admit, and this study, as well as many others that try to do cost of illness estimates using household survey data, will also tell you that it can be quite challenging to get highly accurate measures of those productivity losses. So again, we kind of think about these as somewhat conservative estimates, because there's some challenges with recollections from kind of, previous cholera incidents. But you're certainly right that we would expect kind of the overall cost to economic productivity or costs kind of at a higher than household aggregated level to really exceed what we're estimating here in terms of the treatment costs. And what's more, cholera is an infectious disease. And so there are certainly some of those kind of public health externality costs that we'd want to take into account. And a third thing that we kind of don't measure at all here is the overall welfare cost of being sick or having a sick child. Those pieces are kind of missing from this valuation as well. And so, we suggest that the willingness to pay for cholera vaccination is lower than the actual cost of illness that we see as represented in the combination of household survey data and hospital administrative data. However, we suggest that this has to do with some of the perceptions of cholera vaccines in the area and the difficulty of actually getting cholera vaccines or potential mistrust in vaccination. And so this kind of relates to some of the broader conversations that we have both in the U.S. and in other contexts about vaccine hesitancy or concerns about various types of kind of preventative measures that people might not feel comfortable with or know enough about. And so it suggests that there's kind of space for policy to intervene here, right? To demonstrate the actual value of prevention to encourage this type of preventive behavior.
Right. So in conclusion, both of you, Sarah and Emily, we talked a lot about different ideas about policy interventions where things could get better. But at the end of the day, even if we have the right answers, it doesn't feel like we can push that into policy realm, which seems to run on rules that we don't quite understand. So what is your general sense? Some of the work that you're doing in public policy arena and economics. How do we make some of these ideas really become implementable in the policy layers? What can we do? Sarah, you want to go first?
I think that's a really difficult question. It's something that we're, thinking about with respect to these specific papers, but also I'm sure Emily and I think about this with our work more broadly. It's not enough just to do research. These are ideas that then, hopefully we want to be acted upon. And I don't know. I feel like your characterization of sometimes the rules seem sort of hard to understand. I think that was kind of paraphrasing what you said. Not entirely sure what the right answer is, but I feel like I actually don't have a lot to say about that issue.
No, I don't think they're good answers. I was just posing sort of the question also for the general public.
Yeah.
To understand that, we go through a 4-year election cycle, which is great, but there's a lot of information out there, objective analytical information, but they don't get into the policy realm. It seems to be sort of not very transparent in that way. Emily, do you have an opinion on this?
I think I agree with Sarah, and I agree with you as well, Gill, on the importance of this question. And I think I've seen this demonstrated in some successful and some unsuccessful ways. So I guess I have kind of two thoughts. And one is kind of the overall engagement and involvement of policymakers along the way. So we talked a bit about the work that my co-author and I did on valuing local environmental development or local environmental preservation in Nepal. As I mentioned when we talked about that paper, I mentioned that this was part of a larger multi-year interdisciplinary effort to characterize water resources, water access, water quality in Western Nepal. And as part of that project, we spent a lot of time with local policymakers, national policymakers in Nepal, in the Western region, in Kathmandu, to really try to understand what types of outputs would be useful for them in developing, their policies moving forward. And one part of that project was to kind of help provide some of the inputs to be used in the next 10-year plan for local irrigation, or for national irrigation planning. And so by incorporating kind of the policymakers at each stage of the research process, that project did, successfully have some of these interactions that can be more challenging to come by. And so that's one way, that I think, just being really intentional about including policymakers along the way. policymakers are interested and can allocate that time, it can be very fruitful. The other thing that I'll just mention is that, I think it's important for there to be outlets for academics to share their findings and their research, right? That can be outlets just like this podcast, but it can also be outlets like, respected blogs or policy briefs or other types of kind of public-facing outputs from other researchers that really are designed for the general public or designed for policymakers, because it can be challenging to wade through, a long academic paper to get the main gist or the main policy output. So I think, being intentional about that is really important for thinking about the overall policy impact of your work.
Yeah, exactly. Yeah, this has been great, Sarah and Emily. Thanks so much for spending time with me.
Thank you so much for having us.
Thank you. This is a Scientific Sense podcast providing unscripted conversations with leading academics and researchers on a variety of topics. If you'd like to sponsor this podcast, please reach out to info@scientificsense.com.